Why exactly is it that breastfeeding is best for babies? In other words, why is human breast milk the best for human babies? Well, the reason why is because a mother's milk is species specific. So, cow milk is meant for a baby cow, cat milk is meant for kittens, dog milk is meant for a baby dog, and so on. A mother's milk is species specific in terms of nutrition. This chart shows the composition of milk from different types of animals. So I would like to take a look at human milk, and then because cow milk is the most popular in our culture, let's compare it to cow milk. So first of all, look at the protein. The percentage of protein in human breast milk is only 1.2%, whereas in cow milk, it's 3.5%, nearly 3 times as much protein in cow milk compared with human milk. What about casein? The second column, casein is the main protein found in cow milk. Well, in human milk, it's about half of a percentage point, and then cow milk 2.8%, so a lot more casein. When we look at the whey protein, it's about the same, fat content's about the same. Look at the carbohydrate column, and we see that human breast milk is much higher in carbohydrates than that of cow milk. So basically, we see that the nutritional makeup of cow milk is different than human breast milk. This slide shows a couple other nutritional elements. And again, let's just look at the human milk column and compare it to the cow's milk. So again, cow's milk is almost 3 times as much protein than human milk. What about calcium? We see that cow's milk has way more calcium than human breast milk. 35 here, 113 here. Phosphorus, way more in cow's milk than human milk. Sodium, 40 for cow's milk, 15 for human milk. Potassium, 143 for cow's milk, only 51 for human milk. So we see that the nutritional composition of cow milk is very different from that of human breast milk. So that's why it doesn't make sense to switch the milk between the species. Cow's milk is baby calf growth fluid. It's designed to take a small animal and make it grow to a very, very large animal. Cow's milk is for baby cows, not your mom, not your milk. Just think about it logically. Would you give dog milk? Would you drink dog milk? Would you drink cat milk? Would you drink dolphin milk or rat milk? Of course not. And that's because milk is species specific. Milk is for baby animals, yet many humans continue to drink it after weaning. Infants and children produce enzymes that break down lactose. Lactose is the sugar found in breast milk and cow's milk, but as we grow up, many of us lose this capacity. Lactose intolerance is common, affecting about 95% of Asian Americans, 70% of Native Americans, 70% of African Americans, 53% of Mexican Americans, and 15% of Caucasians. Symptoms include upset stomach, diarrhea, and gas. This is some data from an epidemiological study which examined the association of cow's milk consumption and incidence of type 1 diabetes in different countries. So on this axis here, we have the amount of cow milk consumption, and then this axis shows the incidence of type 1 diabetes. And so you can see very clearly that there is a pattern or a correlation between these two factors, and that the countries with the highest amount of cow milk consumption have the highest rates of type 1 diabetes to go along with it. So we see Finland at the top, highest rate of cow milk consumption, highest rates of diabetes. Then down at the bottom, we have Japan with low milk consumption and then low diabetes rates, and then all of these countries in between. But this data shows that there is a relationship between the amount of cow milk consumption and the amount of type 1 diabetes cases in that country. Exposure to dairy as a baby has been linked with type 1 diabetes. This is something very important for everyone to know. Leading health authorities warn that consuming dairy products can adversely affect the health of infants and children. The American Academy of Pediatrics recommends that infants below 1 year of age not be given whole cow's milk, as iron deficiency is more likely due to the low amount of iron found in cow's milk as compared with human breast milks. A study found in this academic journal finds insulin dependent, also known as type 1 or childhood onset diabetes, is linked to consumption of dairy products in infancy. So that's why the American Academy of Pediatrics advises that babies less than 1 year old are never given cow milk or dairy products. Like Dr. Michael Clapper says, we have no more need for the milk of a cow than we do the milk of a dog or a giraffe. And if this image, makes you queasy or makes you bristle, it's meant to provoke thought. And basically, that is what you're doing. You're just cut out the middleman, and why not just suck from the cow's udder directly if you think you need cow milk, which of course you do not. Milk and dairy products are the main source of saturated fat in the American diet, contributing to heart disease, type 2 diabetes, and Alzheimer's disease. Studies have also linked dairy to an increased risk of breast, ovarian, and prostate cancers. Women who drink 3 or more glasses of milk per day have a 60% increased risk for developing a hip fracture. Drinking 3 or more glasses of milk also increases mortality risk by 93% of all causes. For each glass of milk, risk of dying from all causes increases by 15%. In fact, because of the overwhelming amount of research now indicating that dairy is actually really not healthy for us, last year in 2019, Canada removed the dairy category from their dietary recommendations. And they say to choose protein foods that come from plants more often. And they say make water your drink of choice. And the dairy category has been completely removed.